Welcome back. And it was recently that actress Angelina Jolie brought attention to this BRCA1 mutation, which points to a higher risk of breast and ovarian cancer. And so she ended up having a double mastectomy last year because she tested positive for this. She carries the gene, and she wanted to have the surgery so her children wouldn't lose her. She lost her own mother at a very young age. She died of ovarian cancer at the age of 56. So this is tough stuff, but you need to be, make sure you have your science on your side and help you out. And that's where Dr. Rebecca Edgeworth comes in. You're with Volunteers in Medicine. And so I'm going to be 41 years old in July. It wasn't until Angelina Jolie and her story did I even know that this was out there. Yet you're saying that this is something that you should be tested for if you have risk factors in your family.
That's right. So BRCA1 is a tumor suppression factor. And if you have this mutation, then you are 60% likely to have breast cancer in your time, and about 40% likely to have ovarian cancer.
Wow. And then now also through all of these different studies and research, there's a high form, aggressive form of uterine cancer that's being linked to this gene too, right?
That's correct. So uterine cancer is actually not nearly as common as ovarian or breast cancer. And what's been linked isn't the low-grade uterine cancer, but high-grade uterine cancers, which are quite rare, very rare. It's a 26-fold increase, actually, in getting this highly aggressive in people with the BRCA.
All right, so there are risk factors. Obviously, with Angelina Jolie, she knew that her mother had this risk, so she got tested. But from what I understand, these tests can be expensive to find out if you have this particular gene mutation. So where does Volunteers in Medicine help out with that?
Well, Volunteers in Medicine is able to do just regular screening for people. We treat people who have no access to health care, and the recommendations are for women over the age of 40 to get annual breast exams and also breast mammograms. In our clinic alone, we had 6,000 patient visits last year, 450 of which the women were tested for, just screened for mammograms and breast imaging. 11 of those women had been found to need a biopsy, and then of those 5 women who had no idea that they had breast cancer were diagnosed with breast cancer.
Oh my gosh.
So screening is very important, especially in the patient population we have.
Well, and Volunteers in Medicine is such a critically important part of our community for people who do not have medical insurance, and you're able to help them out. For people who do have insurance, and it's hundreds, maybe thousands of dollars to get tested for this, what is your recommendation on people being tested for this gene mutation?
Right. So the recommendation is not for all women to be tested for it.
Okay.
For people who have primary relatives, meaning a mother or sisters that have had cancers at a very young age, meaning in their 40s, those women should be tested. Any man in the family who's had, it's very rare for men to have breast cancer,
Sure.
but if a man had breast cancer, also if you have cancer in both of your breasts, you should be screened for this.
Wow. And then also, as far as Volunteers in Medicine doing tremendous work in our community, didn't you just donate a hysterectomy to a local woman because she had no medical care otherwise as far as insurance?
Yeah, we did. We're very blessed to have community partners that help us to get women the care that they need. So we can help with screening and with some treatment. We work with community partners that can get people surgeries and the treatments they need for the life-saving surgeries and treatment.
Well, Dr. Rebecca Edgeworth, thank you for your time and talent today, and thank you for what you're doing in the community with Volunteers in Medicine.
Oh, thank you so much.
All right, Dana, we'll send it back to you.
Good stuff. Very important information, so thank you for that.